So I thought long and hard about this and decided, after hearing many families who were just, heard their loved ones begging for relief, I thought I could do this with more guardrails than had ever been proposed anywhere in the country, so it's not abused by a caregiver or someone who just, wants an exit strategy from life.
Significant health news tonight at 11. New York Governor Kathy Hochul says she will sign the Medical Aid in Dying Act into law. Now, the bill barely passed the state Senate vote yesterday, 34-28, after passing in the Assembly with greater support. The new law will allow terminally ill adults an option to use a prescription to end their life. 2 News Side's Nate Benson is following this story for us tonight. And Nate, Governor Hochul is prepared to sign this.
Yeah, that's right, Scott. Governor Hochul said that she required changes to the bill before she would sign it.
Calendar number 49, Assembly number 9515 by Assembly Member Paulin, enactment of the Public Health Law.
Senator Borrello, why do you rise?
Southern Tier Senator George Borrello rose on the floor of the Senate Wednesday to ask the sponsor of the Medical Aid in Dying Act some questions about the bill and changes being made to it. The act would allow terminally ill adult patients with 6 months or less to live the ability to have a medically aided death via a prescription drug. Senator Gustavo Rivera from the Bronx sponsored the bill.
Makes us the 13th state in the nation where an individual who is in pain, who is fully of sound mind, but who considers who is seriously ill and at the end of their life could choose to, on their own terms and with full dignity, choose to bring that life to an end.
Changes to the bill include a mandatory mental health screening by a psychiatrist or psychologist to anyone requesting a medically aided death. There's also a 5-day waiting period between the request and the prescription being filled. An audio or video recording of the request is also mandatory, and insurance companies are barred from mentioning medically aided death when denying coverage to patients. But despite the tighter rules for the act, some senators, like George Borrello, voted against the bill. One of Borrello's concerns is that while the bill intends for a terminally ill patient to have a dignified medically aided death, the bill itself specifically outlines that medication which causes death must be self-administered.
Well, I can tell you, because I have unfortunately close personal experience with the disease ALS, that when you're at the end of your life, you're not physically able to put a pill in your mouth. How are we going to ensure that that person was not murdered by having someone else give them those drugs, even if it was a compassionate thing that they were trying to do? We cannot prove that because we're not doing this in a controlled environment. It's not being administered by a healthcare professional, and no one will be there when it happens. That's the problem with this bill.
But the bill passed the legislature on Wednesday afternoon, and Thursday morning, Governor Hochul indicated that she would sign it.
I thought I could do this with more guardrails than had ever been proposed anywhere in the country, so it's not abused by a caregiver or someone who just, wants an exit strategy from life. This is someone who's received a terminal diagnosis. They only have 6 months to live. There has to be verification, recording of the person saying, I want this, so there's no coercion.
Now, the bill will take effect 180 days after Governor Hochul signs it. On your side, Nate Benson, Channel 2 News.